What is molar pregnancy? A molar pregnancy, also known as a hydatidiform mole, is a type of gestational trophoblastic disease, GTD. This type of pregnancy loss is caused by chromosomal abnormalities during conception that result in abnormal growths of placental tissue. Essentially, this occurs when an egg is fertilized, but instead of developing into a fetus, a mass of fluid-filled cells develops. Except in very rare cases, molar pregnancies cannot be carried to term and do not include a viable, able to live, fetus. Molar pregnancies are usually not cancerous, but in some cases the tissue becomes malignant. Molar pregnancies can have scary health complications, requiring months of precautionary monitoring after treatment, which usually includes dilation and curettage, D&C, a procedure to remove products of conception tissue from the uterus. After treatment, most molar pregnancies resolve without further complications, but there is a potential for lingering adverse effects. Possible adverse effects. About 20% of women who have had molar pregnancies will develop one of two serious problems: an invasive mole or choriocarcinoma. These conditions are more likely to occur after complete molar pregnancies than partial molar pregnancies. These two types of molar pregnancies are detailed below. Only 2% to 4% of partial moles will develop either condition. The risk of developing invasive moles increases the longer the pregnancy continues without treatment and can develop before or after surgical treatment. Invasive moles primarily occur after molar pregnancies, but will occasionally develop after miscarriage or term delivery. Choriocarcinoma is a type of cancer that can develop at the placenta site and spread to the body. The tumors grow from cells that normally would develop into the placenta. While serious, this fast-growing cancer is almost always treatable with chemotherapy. Risk factors. A few risk factors, such as a previous molar pregnancy or advanced maternal age, can increase your odds of having a molar pregnancy. As with other miscarriages, though, a molar pregnancy can occur without any risk factors. Known risk factors for molar pregnancy include the following. Maternal age younger than 20 or older than 35, with increasing risk the older the mother is at conception. Poor nutrition, specifically, low consumption of dietary carotene, which is found in orange fruits and vegetables like carrots, apricots, and sweet potatoes, and animal fat. Previous molar pregnancy, about 1 in 100 will experience a repeated molar pregnancy. Previous miscarriage. Rates of occurrence vary significantly worldwide, with some countries, particularly in Asia, experiencing much higher incidences than others. In North America, hydatidiform moles occur in about 0.6 to 1.1 of every 1,000 pregnancies, whereas studies in Southeast Asia and Japan have shown rates as high as 2 in 1,000. The differences in incidence patterns are primarily thought to be due to nutritional and other socioeconomic factors. For example, in Korea, rates of molar pregnancy dropped from a high of 4.4 per 1,000 pregnancies in the 1960s to around 1.6 per 1,000 in the 1990s. This change is attributed to concurrent improvements made in the diet and living conditions of the general population.